Greetings all. I hope everyone is doing well today. We are going to get things started in a little bit, but we just want to give everyone time to join the webinar. All right, we're going to get things started. Welcome, good afternoon. I hope everyone is doing well today. Thank you for attending today's webinar on addressing the impact of climate change using the CHAMP program. My name is Chris Walker, Senior Program Analyst for the National Environmental Health Association, and I'm happy to welcome you all to this webinar. The agenda for today's webinar includes a quick overview of who we are as an organization. If you are not familiar with us, we will provide an overview of our CHAMP program. We will also talk about the project activity that connected us with some amazing jurisdictions. We will then give the jurisdictions an opportunity to share on their climate and health project. Following the presentations, we will move into our panel discussion with a representative for each jurisdiction to share their experience. Then we will wrap things up. Allow me to cover a few housekeeping items before we get started. Please note that there will be a Q&A session period during the webinar. We will take a few questions from the attendees upon completion of each jurisdiction's presentation and also during the panel discussion. Please feel free to drop your questions in the Q&A box during both. Please understand we may not be able to answer them all. At the conclusion of the webinar, you will receive a link to take part of an evaluation where you will be able to provide feedback on today's webinar. We thank you in advance for attending today's webinar and letting us know your thoughts. As we know, as some of you may know, and we hope that everyone may know, environmental health plays a major role in protecting public health. The air we breathe, the food we eat, the water we drink, those are just a few examples of the roles of EH. As an association, everything we do is to build, sustain, and empower environmental health professionals so that they are equipped and prepared to protect the health of communities across the country. Now, with climate change, that is the biggest health threat of our lifetimes and will impact vulnerable populations the most significantly. The environmental health field works at this intersection of health and the environment and plays a key role in the development of solutions and helping communities adapt to the impacts of climate change. Some examples of climate health impacts: you may have new or increased presence of vectors in communities due to increased temperatures and or humidity, compromised private wells or community water systems and septic systems due to extreme flooding, indoor air quality issues due to increased humidity and moisture. Given the opportunity, the environmental health profession has been and can continue to be a part of the solution to address these impacts. Now, a little bit about our program, the CHAMP program, which is the Climate, Health, and Adaptation Mitigation Partnership Program. The program encourages local jurisdictions to progress towards meeting the U.S. Department of Health and Human Services Healthy People 2030 objectives, promotes health equity by raising awareness of how climate change associated environmental health hazards disproportionately impact the health of various communities and population groups, as well as helps to advance CDC's Building Resilience Against Climate Effects framework, which is the BRACE framework. This is a 5-step process that allows health officials to develop strategies and programs to help communities prepare for the health effects of climate change. Through the CHAMP program, we encourage and support local jurisdictions to identify unique climate-related health risks impacting their community, develop responsive climate adaptation plans to address those impacts, implement targeted adaptation actions to protect communities from climate change-related environmental health hazards. Also, becoming a climate champion who actively supports local climate and health-related environmental health programming. And lastly, just working through the various phases and activities of the program framework. Building capacity through education and application, building partnerships where we're not the only ones that are working in this realm of climate and health, but making those stronger connections with stakeholders on similar impacts. So with support from the Centers for Disease Control and Prevention, we work with Washington Department of Health to incorporate some health and all policy strategies into climate and health work. For those who may not be familiar with health and all policies or HIAP, it is an approach to public policies across sectors that systematically takes into account the health implications of decisions, seeks synergies, and avoids harmful health impacts in order to improve population health and health equity. Some of those strategies would include development and formation of cross-sector collaboration, incorporating health into decision-making, enhance workforce capacity, integrating research, evaluation, and data systems, implementing accountability structures. These strategies are examples, are already components within the CHAMP framework. So it was a great opportunity to work with our demonstration sites on these particular activities. In this work, Washington Department of Health was identified 2 local health jurisdictions to support in their climate and health activities. Those jurisdictions were Jefferson County Public Health Department, with trying to address the impact of wildfire smoke in their community. The other jurisdiction was Tacoma-Pierce County Health Department, with their challenges on extreme heat in their community. Washington Department of Health provided oversight with their climate and health coordinator from the Office of Environmental Public Health Sciences. The work started around March, April of 2022, where we provided technical support on these project activities. And just to give you a little bit of background of the local health jurisdictions that were a part of this, we have Jefferson County, which is located in the northwest corner of Washington State on the Olympic Peninsula. Port Townsend is county seat and its largest city. Now, there is a total population of 33,000 within this county. This county contains mountainous and forested lands within or just outside the boundaries of the Olympia National Park, which are in the center of this county. And you can see in the picture, definitely just a beautiful area. And now we also have Tacoma-Pierce County, which their health department serves a population of a little over 937,000 people. A quarter of Pierce County's population live in Tacoma, Washington. This is also home of Mount Rainier, the highest summit in the Cascade Range. Now, we want to take the opportunity to welcome our demonstration sites. We're going to first start with the state representative, which we have Marnie Boardman, who is the Climate and Health Coordinator for Environmental Public Health with the Washington State Department of Health. We now go to our local representatives. We have Michael Dawson, who is a water quality manager for the Jefferson County Public Health. And we also have Laura Gaslin Tatro, from which is an environmental health specialist for Jefferson County Public Health. They represent our Jefferson County department. And now we will also welcome Tacoma-Pierce County, which we have Cindy Haverkamp, a climate and health coordinator for Tacoma-Pierce. We have Jackie Busby, Environmental Health Specialist with Tacoma-Pierce. And we have Rihanna Betancourt, an Environmental Health Specialist for Tacoma-Pierce County. So we welcome them all. We're going to first start with Jefferson County for them to talk about their project, and then we'll take a few questions for them, and then we'll go to Tacoma-Pierce. So let me share. So do we have, I think we have Laura. Are you able to share your screen?
Actually, I'll start with a real brief introduction and then let Laura take over, if that's
Perfect.
okay.
The floor is yours.
Thank you, Christopher, for that introduction. See if I can share my screen here. Okay, are you seeing that?
Yes.
Great. So as Christopher mentioned, we're a pretty rural county in Washington State. Don't have a very big population, but we do have a population that tends to care about public health and the health of the environment as well. We have both mountains and forests and ocean. We have actually 200 miles of shoreline in our county. And we have, for our population size, I think a pretty robust public health department. And within that public health, we have an environmental health division and a water quality division. The water quality program is focused on surface water pollution, so it's not always the first thing people think of when they hear water quality. And for quite a while, we've been, interested in climate change and what it's going to bring to our community. And we started looking at projections and specific projections for our county, with things like changing precipitation, changing heat events, and coastal flooding. So there's a lot of climate related issues in our area. And one area in particular is one that Laura is going to talk about in just a second here. This is a view of the same county courthouse tower from a little different perspective on a very different day from the previous image. And I will let Laura go ahead and tell you some more about how we're dealing with the kinds of wildfire smoke issues that we've been seeing more and more, not only in our county, but all over the West.
All right. My name's Laura, and I'm going to talk a little bit about some of the challenges that we have. Let me share my screen here. All right. So Jefferson County, Washington, an example of climate adaptation in a rural county. We focused mostly on smoke events, but a little bit on heat as well. We've been seeing increased wildfire smoke throughout the Pacific Northwest, as well as higher temperatures, including a heat dome in 2020, where the mean was 30 degrees Fahrenheit hotter than the mean of the 3 hottest months in the last decade, and a maximum of 61 degrees Fahrenheit hotter. So that's really hot, especially for here. And this is a challenge with both smoke and heat for the following reasons. We have a rural county with a population of 33,000, but most of our buildings, especially our public buildings, are old, some very old, with very few places for cooling or safer air. And very few homes have any way to cool down through AC or modern ventilation systems. On top of this, we host large outdoor summer events, sometimes with another 30,000 people coming to town. who are expecting to camp and be outside the entire time because we don't have facilities for indoor spaces. An example is the Port Townsend Wooden Boat Festival, which is the second largest wooden boat festival in the world. Here you can see that it's quite crowded. There's a bunch of really neat old boats that come in, but when we have a smoke event, it can be quite dangerous for people. And these are some smoky days at one of the recent wooden boat festivals. To help work on this with this NEHA project, we updated our county wildfire smoke policy to make it clear and concise and fit the state and national standards. We've been coordinating with partners on heat and smoke response, such as the local hospital. Yes, there's only one, the emergency medical services, public health, and anyone else that helps with the responses should there be a heat or smoke event. The other thing we're working on is educating people, especially event coordinators, because there's so many events here in the summer months on smoke and heat safety. This includes training for people who run large events, music festivals, the wooden boat festivals, but also summer camps, summer schools, parents, and the public, where we are training them on danger levels based on various AQIs, where to best access good guidance, because a lot of it is getting the information out, and how to create safer airspaces for folks. This is a key, especially for children and anyone who might be more sensitive to poor air quality. So that is what Jefferson County has been working on with this NEHA project.
Awesome. Thank you both, Michael and Laura, for the work that you're doing. One question that I have, and for the attendees, please use the Q&A box if you have any questions about their overview. But I believe, Laura, you had talked about kind of the training on heat safety. As far as the public, is the public aware of this type of information, or did they not have any idea when it comes to protecting themselves from heat-related events?
It's been pretty mixed, but it's new. This is not an area where historically we had especially sustained heat like we have recently, where it's over 110 degrees. Houses aren't built for it. People don't really know how to passively cool or be proactive with it. So we're really working on educating the public on how to adapt to that.
Awesome. And have you had any particular issues, I guess, with some of the vulnerable populations, maybe some people with older age or people with immunity issues? Any type of things that you've been doing there as well, or kind of similar education?
Similar education. We're working with the local hospital to target people who are particularly at risk, who have health issues, or are the more elderly or very young or pregnant people. But we're also trying to figure out how to best support people who are and underhoused, which is a lot of folks here. And that is a bigger challenge, because how to get services to people who may not have transportation or be easy to access and get the information or help to as well.
Okay, thank you for that. I think we do have a question. Could you go into a little more detail about the new updated policy you mentioned regarding smoke and heat? Are there regulatory actions involved, or is it primarily focused on E&O?
It is primarily focused on education and outreach. There will be levels where our health officer may put out restrictions of some sort, especially for some of the large outdoor events. But at this point, almost everything is based on education ahead of time and just getting the guidance out there so that people can make smart, safe decisions.
All right, thank you for that. And we do have another question. And this can go for both Michael and Laura. How do you see, from a sustainability standpoint, how do you see this environmental health initiative being maintained in the future? And are you seeing any buy-in from city, county government leaders, et cetera, as well as other stakeholders?
Yeah, I can take a stab at that. So sustainability is definitely an issue. We're fortunate enough to have a certain amount of state funding now for work in climate related areas. And the other thing is we've been very fortunate in having political support for addressing climate impacts. All these things can change with the whims of different electeds and things like that. So building a long-term sustainable program is always going to be a bit of a challenge. And I think we've got to start, but we still have quite a ways to go in terms of building our program. And also, frankly, just getting awareness of it out there, because it is pretty new for our department.
Awesome. Thank you for that response, Michael. I do want to thank both Michael and Laura for presenting. Great work that you all have been doing. We hope you continue success on the work and education that you're doing. And now we're going to move next to our other local health jurisdiction, which is Tacoma-Pierce Health Department. So Cindy, Rihanna, and Jackie, the floor is yours. Whoever wants to start.
Thank you so much, Chris. We're going to start today with Rihanna, but I would like to introduce our CHAMP team. It's Rihanna Betancourt and Jackie Busby. We've all worked very hard together on our health department's first heat action plan. And the heat action plan will be the first of many climate adaptation plans that we'll be working on. So go ahead and take it away, Rihanna.
Thank you, Cindy. Yeah, so where we were, where we are, and where we're going. So what I'm going to do, without going into too much detail for the sake of time, is kind of just try and paint a picture of where we were at before Cindy and Jackie. So think pre-COVID and 2019 and high level. Tacoma-Pierce County Health Department is comprised of 4 divisions: administrative services, communicable disease control, strengthening families, and our environmental health division. Within the environmental health division, we have a small program called Social, Economic, and Environmental Conditions for Health. And that is a relatively new program within the EH division. So in the environmental branch of that program, there was only one environmental health specialist supervisor that existed. The rest of the teammates were health promotion coordinators. So limited funding to expand environmental programmatic work. We didn't have a lot of people or funding. So for example, in our work, we were focusing on healthy housing, indoor air quality, and asthma, instead of like how climate change and extreme weather events like heat can impact and exacerbate those conditions. Even though we're well aware of the impacts, we were kind of limited in what we could focus on. So we also have We also have a separate climate and health team, which functions cross-divisionally. So the members of that team are made up of different people across the different divisions that are just kind of interested in learning about and talking about climate and health and how it might touch their work. So during that time, 2019, that cross-divisional team began doing some things like lunch and learns to help educate staff across the divisions about how climate change affects health and consider how it might relate to their work. They were also able to get an EV charging station installed at the health department, which I think is a pretty cool thing. The capacity of this team is expanding a bit now with the addition of Cindy as the climate and health coordinator lead. So that is very awesome, I think. So over the last few years, the social and economic and environmental conditions for health program has expanded significantly. We now have 3 more environmental health specialists in our program, which includes Jackie and I. I am also a NEHA member. With the expansion of the environmental health specialist sort of capacity in our program, it gave us some ability to focus a little more on environmental justice and climate issues. And so that is the high level picture. And with that, I am going to pass it to Jackie to talk a little bit more about when we sort of started with this project.
Thank you, Rihanna. Yes, I'd like to just start by touching on our experience with getting the CHAMP program going and some background information on what our focus was with that. So as Laura mentioned, we experienced the heat dome of 2021. So I'd like to spend a couple minutes on this event and its effects it has and had. So from June 26th to July 2nd, an abnormal high pressure ridge amplified over the Pacific Northwest, leading to an unprecedented heat wave over the region. This historic heat wave accounted for at least 600 known deaths due to heat exposure across the Northwest and Canada. So extreme heat is deadly. It kills more people in the US each year than any other extreme weather event. Temperatures above 82 degrees Fahrenheit significantly increase the risk of cardiovascular diseases, respiratory illnesses, and heat stroke. Importantly, anyone can get ill from extreme heat, but outdoor workers, young children, older adults, people experiencing poverty, and people with chronic diseases are particularly vulnerable to the impacts of heat events. So with all these things in mind, our team decided to focus on extreme heat for our NEHA CHAMP program and starting the program with creating a heat action plan. So our heat action plan outlines areas of Pierce County heat incident management, mitigation, preparedness, and resilience. It also touches on different sections such as education and communication, community relationships in the built environment. And we modeled our heat action plan after California State's action plan to build community resilience. We chose their plan because they are very familiar with dealing and responding to extreme heat, and they're an environmental leaders also. So we thought that was a good choice and a good model for what we wanted to do at our health department. One more thing is that we also created an extreme heat response plan, which describes the anticipated actions that our health department would like to take before and during an extreme heat event to protect community health and limit health disparities. So it's a bit of background and a kind of big, broad overview of some of the things we did. So I will now pass it over to Cindy. Thanks.
Thank you, Jackie and Rihanna. Great job. I will be talking next about some barriers and challenges, as well as where we plan to go from here. So probably the most challenging part of this process was a very short turnaround for deliverables. Also, new staff was hired in the middle of the process. That was me. So we got the grant money in March. I was hired June 1st, and our first deliverables were due July 31st. So this was a big challenge, but we put together an amazing heat action plan. And I really appreciate the work that Rihanna and Jackie did before my arrival to make it possible for us to complete that work on time. Another challenge has been rebuilding partnerships with community partners post-COVID and re-engaging people in climate work. Everyone was very focused on COVID challenges. Many health department employees were activated for COVID. And after COVID, even with our partners, it's been difficult to kind of steer the ship in a different direction. And that direction that we really need to move in is climate change awareness and adaptation. So we are hoping to go from here to update our heat action plan. We've gotten a lot of feedback from community partners about how this plan could be improved, and we plan to do some changes to it and make it better. And also we are continuing to modify our heat thresholds and also all of our extreme weather thresholds in communication with partners and community organizations. So heat response plan will also be updated in this next couple of months. Some things that are really exciting about our partnerships is that our partnerships have led us to develop contracts with local organizations like the Tacoma Tree Foundation. We have a contract with them right now to provide additional outreach and support to the community around urban tree canopy and to get 1 million trees in the ground by 2030. That's our goal. And by doing this, we will reduce urban heat islands and help to improve the lives of people living in parts of our city that don't have a lot of tree cover. Additionally, we have a great relationship with the Pierce Conservation District, and we are also helping them by helping to fund one of their new staff members. They have hired a wildfire smoke project manager, and we will be working with them to provide community education around the health impacts of smoke by joining them on their FireWise visits to homes around the county. So this, thanks to CHAMP, we've made lots of inroads with community partners, lots of great activities are occurring and lots of things to look forward to. We do hope to do a bit more work in protecting vulnerable populations. That wasn't so much a focus of our first efforts, and we really need to move in that direction in the future. That's all for now, Chris. We can take some questions.
Awesome. Thank you so very much. Great information. And thank you all for what you're all doing. So a few questions. And I know we had one person, or at least Michael, to respond in chat, but I want to ask the same question to you all as well. What challenges do you encounter when managing response to climate emergencies, extreme heat and smoke, with tourism for major events? That's something, especially with the extreme heat piece, just seeing if there's anything that y'all are doing in that realm as well.
I'll answer that one, Chris. I'd say the biggest challenge in dealing with heat emergencies for us is not so much the tourism aspect, but it's more getting everyone in our county on the same page about our heat activation thresholds. We've had a lot of conversations, and we're trying to learn from King County, who has done a lot of great work in developing heat thresholds that work for our area. So we are still having those conversations internally and with our partners about what our heat activation thresholds should be. We do have some, I think the area maybe that has a little bit to do with tourism is we have some relationships with our park system, and the parks folks are reaching out to us and asking questions about air monitoring, specifically for wildfire smoke, and making sure that they don't have large tournaments for baseball or golf, even large activities where people could be experiencing heat illness or smoke illness.
Awesome. Thank you for that. We have another question. Your climate and health team sounds very impactful to your operations. Can you share the wins, any specific accomplishments, and or notable outcomes they made in the past year?
Rihanna or Jackie, would you like to respond? I think Jackie has some great things to share about schools and air monitoring.
Sure, I can share on that. Yeah, I started about a year ago, and a big part of my job is getting purple air sensors into schools. So through our climate and health work and through our team in general, we've been able to get close to 30 air sensors into schools. youth centers, camps throughout the county. And this has been really beneficial. So when people are experiencing wildfire smoke events or any sort of poor air quality, they're able to reference this tool that we've provided for them. So I'd say that's a pretty big win in our book, and we got some more work to do there, but yeah, thanks.
And
Oh.
Rihanna worked on a really great infographic about heat, and maybe she can share a little bit about that.
Yeah, thanks, Cindy. I didn't think I would share my screen during this, but I can post the link to it in the chat. But we have the health department likes to do infographics, and after the heat dome event, we needed something tangible. We needed something online that was easy to understand and that we could print and also like distribute at community events and have it translated into the top 8 languages to get the information out there widely. You know, and it's a small thing, but last summer we distributed hundreds at community events. People were very interested in learning about the heat health information, and I am just grabbing it off of our webpage right now, but that it was a small win, but it felt really good to start getting that information out there.
That's amazing, and we'll give you some time to do so, to kind of either add the link. Also, if we have the time, you do have co-host privileges to be able to share the screen once you're able to identify it. But we're going to keep things moving. So, oh, you've already added it up there. So, thank you all. Thank you, Cindy. Thank you, Jackie. Thank you, Rihanna. Y'all are doing great work in Tacoma-Pierce. We've now we're now going into the panel discussion. So we're going to have a representative from each organization. So I think we've identified those wonderful people. I think that's going to be Cindy, Michael, and Marnie. So if you're able to have your cameras on, we're going to do a little bit of discussion just on your experiences, where you're at, where you hope to be. And then we'll, once again, the attendees, you have the ability to ask questions. So just talking about their experience, and I'm first going to start with Marnie, as the state representative and providing oversight. I would love to ask you first, Marnie, what is your initial experience in participating in this project activity on climate and health? And also, how did this activity provide support to the 2 local health jurisdictions? So we'll start with you first. And you're on mute.
Thank you. Thanks. Yeah, Chris. So one of the CHAMP opportunity came at this really critical moment. At the state level, at Washington State Department of Health, we had been working on climate and health, but did not have, we'd been really piecing it and partners together. And what we, at the time that the CHAMP grant came along, we were still not in a situation where we had funds to support our local health partners in carrying out climate and health grant. And so the CHAMP grant gave us that opportunity. It was just literally that opportunity to put funding on the ground into the hands of local health where this work is most relevantly put into practice and can make a difference in strengthening, our public health system, and work obviously with community partners. And it wasn't by any means, this was not a lot of money. It was just the fact of having that focus and those funds, and giving us all collectively space and time and a reason and focus to come together and to develop a scope of work and to have meetings together and to try and collectively put our arms around how to build a foundation for climate and health work, together, the state working with each of the local health jurisdictions and the 3 entities working, of course, with NEHA all together. So that was, I know it sounds simple, and basic, but it really makes all the difference in kicking off this work. So that's one reflection. And a couple, it turns out that happened just as here in Washington, we have been working on foundational public health services and an effort to really bolster core environmental public health services across the state for some time, and core public health services. And working to get dedicated funding for that at a systems level from our state legislature. And again, the CHAMP grant came at this really opportune time. It allowed us to see what that might look like in working on climate change and health. And it so happens that just around the end of the CHAMP grant, we began to be able to provide funding to the state legislature, that is, began providing funding to multiple local health jurisdictions, a little bit of funding to begin doing climate change and health focused work. So the CHAMP grant has been this model for figuring out how to get that work started, how to build a foundation. So it was really great timing.
Awesome.
We had a couple of evaluation findings from the project, but maybe I'll just take a break to see what the others have to say.
Awesome. Thank you, Marnie. And that's the thing. We have to start somewhere. We're not going to be getting, hopefully you swing for the fences and you get $1 million grant, but you have to start somewhere. So every little bit counts, and the purpose and the value that it brings is immeasurable. So thank you for that. Now I do want to go to Michael. We're going to kind of get some local health perspectives. So kind of the similar question, just kind of sharing your initial experience in participating in this project activity focused on climate and health. How were you able to positively impact your jurisdiction? And maybe some of the historical reference on maybe what has been tried in the past.
Yeah, sure. Yeah, in our program, we did have some early on effort to deal with climate change impacts, mostly in the form of a county and city collaboration to form a climate action committee. And that committee is still ongoing, and it's done a lot of great work on things like greenhouse gas reduction targets and producing some plans for both jurisdictions. And that was kind of a great seed that, for one thing, led to a good partnership between the two jurisdictions, but also, we started basically dedicating some staff time and effort, but not much, just, there was never really any funding in the beginning. And we started having talks with State Department of Health, with Marnie, about some other ways to begin working specifically on climate and health related things. And we were kind of going along, and then the pandemic hit and kind of put the brakes on some things for a while. But then when this NEHA opportunity came along, it was really good for us in a number of ways. For one thing, providing some direct support and a framework, really, frankly, that was really a catalyst for us to say, okay, now is the time to dedicate a little more staff time and think of this as a program in our department rather than just, other duties as assigned kind of stuff that typically happens when you're ambitious and you want to do a lot of different things, but you don't really have it organized in a more formal way. So that's kind of how it worked for us. And I still feel like we're in the beginning stages in a lot of ways. We have a lot more that we would like to do. It's kind of amazing very quickly when you start opening the door to an opportunity, and it's kind of sort of like opening the floodgates of, why don't you do this and that and this? Because there is a lot of pent up need for addressing a lot of different topics. We have to kind of still narrow our focus to a few things that we can be working on right now. But there's a lot more to do. And so we've got a good start, and I feel good about that. And we hope to be able to build as we go along.
Awesome. Thank you for that, Michael. Cindy, I'm going to pivot to you. I see we have a question, but I'm going to pivot to Cindy. I know when you were talking, you talked a little bit about partnerships. And we know in partnerships or in climate and health is not just one entity just dealing with the impacts. We're all affected. But I would love for you to go into more detail, maybe with one particular partnership that you found this was invaluable, and what did they bring to the table with this partnership?
Thanks, Chris. It's really hard to say which partnership is most valuable. Two that really come to mind are our relationship with the Department of Health. Thank you, Marnie. There is absolutely no way I could have done this job without Marnie's help. I am new to the profession. I don't have a public health background, and I haven't done a lot of climate change work actually in my previous career. So both the CHAMP grant and Marnie's guidance and assistance have been completely valuable and needed for someone new to the profession. The CHAMP grant the CHAMP program lays out such a clear path or a roadmap for how this work should be done. And luckily, I have a lot of relationships with partners in the community I'm on a number of community boards, and I've met a lot of folks because I was doing a career change. So I wanted to get to know some folks in the new area where I wanted to work. And through those partnerships, I could really see on the CHAMP model where those relationships fit in and how I might be able to talk to people that I already know about how to move this work forward. So I'd say we had a number of, we were kind of ahead of the game in a way because of those relationships as soon as I started. The other relationship that is new for me is our relationship with the National Weather Service. Reed Walcott, the warning coordination meteorologist for our part of the country, has been incredibly helpful. He helped us provide a county-wide training on the heat risk tool, and he is basically on speed dial for consultation, and I can talk to him anytime. So if it was not for Marnie and Reed and so many other amazing partners, even internal partners, we have a group called Public Health Emergency Preparedness and Response. The folks in that group internally at the health department helped me learn how to manage public health emergencies and led me through step-by-step how to be an incident commander and how to manage those situations. And another internal partnership that's important is our relationship with our assessment, planning, and development team. They have provided a lot of very important data, which helps us to see or refine our extreme weather thresholds. So how many people are getting injured by cold or hot weather? How many people are being injured by wildfire smoke? They are the folks who are able to give us that information and to help us see when maybe we are overactivating or underactivating, depending on vulnerable populations and just the people of our county. So partnerships are integral to this work being successful. That's why I'm so glad to see that it's on the CHAMP wheel and it's an important part of this work.
Awesome. Thank you for that, Cindy. Now I'm going to go to you, Marnie, because we do have a question for you in the Q&A box. So Marnie, you mentioned that NEHA grant helped to jumpstart things. Now the state has kicked in. Is it enough for an effective statewide program? And do you have a priority list for local health departments to pursue at their levels?
That's a really good question. Two questions that are big to answer. But the first, the fact that CHAMP has helped set the stage is key, and the foundational public health services funding is a sizable investment by the state legislature. It is, but it is only currently funding 11 of, I believe it's 11 of our 35 local health jurisdiction departments and districts. So it's a very important, needed, big sea change for us. But as Mike said, there is a lot of pent up need. And, a lot of this work is about, some of it is about addressing problems that we already knew, were problems. It's not just heat, it's not just wildfire smoke, it's harmful algal blooms, it's a changing regime and in the future, changing set of risks that could influence waterborne illness and foodborne illness and mental health issues. It is, so I think all of us are going to need to focus on how we're transforming the public health system to be conducting public health in a way that is considering both the current climate sensitive hazards that we need to deal with, but and future climate sensitive hazards. So it's a lot of changing paradigms. And so in some ways it's, it's enough to, it's important to be funding people to just public health practitioners to sort of think in those new paradigms and be thinking about how do we use climate change projections to anticipate risk, and how do we partner with our meteorological sector and National Weather Service to do our work in different ways. And this new kind of programmatic funding helps to get us there, but there are so many more investments we need to do. If we think about the ways in which climate change hazards are already, but only increasingly are going to impact overburdened communities, in particular, communities that are already experiencing the worst and first effects of climate change. We know there's so much that we need to be doing to invest in the built environment and the resilience of our natural environments so that we are, preventing exposures and preventing harms to human health. And the people who really need those investments the most are the ones that there's just a huge amount of underinvestment, frankly, in this entire entire arena. So is it enough? It's a great start. That was a long answer, but and as far as like some of the measurements, if it's okay, Chris, may I just share one slide to show some of the evaluation findings from our work? Would that be
Sure, I can give you 1 minute.
great? What I wanted to showcase is just, let's see if I get the right one here. Is that working?
Yes.
Okay. So one of the, I don't know how messy that is there, but hopefully you can see that CHAMP wheel there and just the critical investment that CHAMP made in these first two pieces that both Tacoma-Pierce County Health Department and Jefferson County Public Health have been talking about. And that's that investment in staff time and training. And in a really short amount of time, the CHAMP partners reviewed collectively over 150 unique resources, training experiences, webinars, and created ongoing quarterly workforce development plans. And we found as a group that ongoing investment in that kind of training is really important, and it feels like time away from the job potentially, but it actually accelerates the work. It's by taking the time to read, for example, the climate adaptation plan that the county planning department put together, or taking the time to see what the hazard identification and vulnerability assessment plan that your emergency management department put together. Taking the time to sort of take a look at what's happening in your community it feels like a luxury, but it in the end actually helps accelerate this work and further helps accelerate your engagement with those partners. And that's the other piece I wanted to highlight is talking with partners, engaging with partners. In those 8 short months, Jefferson and Tacoma-Pierce engaged over 60 partners and had all sorts of meetings with all sorts of groups. And that engagement time is hard. And the training helps you be literate and credible and be able to talk about climate change, both sort of short-term response to climate hazards, but also conceive of roles in, if you're talking with partners who are doing longer term climate adaptation. So as far as metrics go, I think it's useful to actually consider metrics around training and workforce development plans and take a look at the kinds of partners and frequency of and quality of partnership and relationship building. They sound very process oriented, but I think it can have dividends to building really solid multi-sectoral climate adaptation plans. And maybe the 2 local health jurisdictions would like to build on that a bit, but I just want to emphasize the importance of that training and partnership development time.
Perfect. Thank you, Marnie. We are getting at the end of our time, but I would like as we conclude, for Michael and Cindy, just quickly, what encouragement would you give jurisdictions wanting to address climate and health impacts within their environmental health programs? So some closing remarks. I'm going to start with Michael, and then we'll end with Cindy.
Yeah, thanks. Well, I would just encourage people to just take a step, even if it's a small one, if you can pick one topic and make a case for why it's important to your community and try and get some, community support, departmental support, political support. I think once you are talking about one specific type of climate issue that your community is facing, you get a lot of buy-in and potential partnerships that start coming out of the woodwork.
Perfect. And Cindy, same question.
Yes, I will just continue to speak about partnerships. There is a lot of great work already happening in your community, and it's important to reach out and find out what that work is to help better lead and design your health department's experience. So we've got great relationships with the city of Tacoma. They have a sustainability 2030 plan, as well as our county. And by reading those plans and speaking with those staff members, it's really helped us to determine direction for our own department.
Awesome. Thank you so very much. You all have been amazing. I can't thank you enough for just the work that y'all have been doing. So thank you to Washington Department of Health, Jefferson County Health Department, Tacoma-Pierce Health Department for sharing your experience in addressing the impacts of climate change. We hope their challenges and successes give attendees from other organizations the encouragement to develop climate and health focused activities within your own jurisdiction. This is recorded, so you'll have this as a resource, but please look at the evaluation. Please make feedbacks and comments and things that you may need support with. So thank you all very much. We hope you enjoy the rest of your day and take care.